Bonjour, mes amis. It is absolutely delightful to be here with you again this evening. And I'm joined by the most fabulous Dr. Stephanie Nielsen, and we are going to be talking all things inflammation this evening. And what a big word we are talking about. Steph, how many definitions of inflammation have you heard in
Oh
the
my
course of your
goodness.
career?
On and on and on and on.
Yeah. Do you have a favorite definition of inflammation at all?
No, I don't think I do. I think I've had so much
Yeah.
of it. I, I focus not on the definition, but on the elimination. Do you have a
I
favorite definition?
Do I have a favorite definition? No, but I have gotten some pretty incredible guesses at it. And I think the best was someone once thought that inflammation was effectively like hormone patterns. They mixed up systems. It was very endearing, but it just goes to show you that so many people hear about it, they get concerned about it, but they're never really grounded in what do you exactly look for and what do you exactly do about it. And so I'm glad that I get to chat with you this evening and kind of tackle those two topics.
Well, I think there's two things. There's one, there's acute inflammation, and then two, there's
Mhm.
chronic inflammation, and they present very differently.
Yeah.
So if you're looking at acute inflammation, you're looking at, I cut my finger, it swells. Now that we're going into summer for a lot of us, bug bites
Yeah.
and chiggers and,
Hmm.
and then you've got an area that itches and scratches. That is acute inflammation, and there's nothing cute about it. But then there's chronic inflammation, and chronic
Hmm.
inflammation is when an area loses a lot of its function. And because dis in Latin means bad, dis-ease, dysfunction,
Mm.
you know, if you look at dysbiosis, you've got a bad makeup of guts in the bowel, which then cause an inflammation. If you've got skin rash, whether it's psoriasis or eczema, this is a
Hmm.
form of inflammation. So,
Yeah. 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 Where the body's just gone into overdrive and doesn't
right.
overdrive in the sense of it's needed because there's this agitating factor that's not being addressed,
Yep.
or overdrive in the sense that it doesn't recognize it needs to pull back a little bit. Yeah.
Right.
Yeah. So I wonder, I want to kick things off a little bit differently this evening because I think because so many people grow so markedly concerned around inflammation and it feels like this monster in the corner that they don't know how to address and they feel like it's always going to be there. I wonder if you can talk us through your story of inflammation and how it is something that we actually truly can get a grasp on.
Well, I actually have two real big ones.
Oh.
So many of you know that back when I was younger, I had cancer. And I've said many times, I was
Mhm.
21, I was in pharmacy school, and I ended up with cervical cancer. And it's like,
Mhm.
oh my goodness gracious, how
Mhm.
could I be so young and have this?
Yeah.
But what I didn't understand was my genetics at the time. I knew I'd been a sick kid. I didn't understand that chronic inflammation of all my
Mhm.
mucosal tissues. I always had asthma. I
Mhm.
always had eczema. I always had, but in a woman's track, the vagina is also mucosa, just like the mouth. And
Mhm.
so all the chronic inflammation, all the yeast infections. I had a yeast infection for 9 months straight. Now, how many of you have ever had a yeast infection? I'm going to ask you to put in the chat. You can put a one if you've ever had a yeast infection or maybe a urinary tract infection, and you know how miserable that is. So how many, if you've had a yeast infection, put it in the chat.
Yeah, I'm seeing a
Oh
lot of
my
ones
gosh,
come up
there's a
on our
few of you.
screen.
And you
Oh,
know that two,
there's even
three,
someone
oh,
that was like,
Barbara, 2 or 3 days of that is miserable. I want to tell you, 9 months, 9 months.
yeah.
And I was like this. I was like,
I can't I can't
can't
imagine.
even imagine. I know,
Can't
I get it.
imagine.
But the problem was, I didn't realize it was my diet. I
Mhm.
called myself a vegetarian. I was a dessertarian. I was a sugaritarian. I was a carbitarian. There were
Mhm.
no vegetables in sight. I was in college, whatever, quick, easy meals, ramen noodles. And then the weird thing was, we treated it, it went away, it'd come right back, treated it. I ended up with what's called carcinoma in situ, which is active inflammation on my cervix that had turned into cancer cells.
Mhm.
So we burned it off. We actually lasered it. Laser was brand new back then. but you can cut it out, freeze it out, whatever. And shortly after, it recurs.
Mhm.
Now, I said, oh, I'm not going through this again. What do I need to do? They wanted to give me a bone marrow transplant, wipe my whole immune system out. And I said, there's got to be another way. And I had a young resident say, you don't need all this medicine. You need to change your diet. I said, how do I do that? What I didn't realize at the time is my genetics. I am a celiac. I cannot handle gluten. I cannot handle processed dairy. And that's mainly what my diet was consisted of, that and sugar. Sugar just
Yeah.
feeds candida. So fast forward 2 years later on a strict diet of protein and greens, very much a Mediterranean type-ish diet, but
Mhm.
very strict, low carb. I healed, everything healed.
Mm.
Well, so let's fast forward. I'm now in my 60s. And this past year, we brought out the DNA 360. And when we did, I offered to
DNA
be,
breast 360. You're
thank you,
so close.
DNA breast
It
360.
becomes
Yes.
relevant, I promise.
Yes, no, that is true. DNA breast 360. And I offered to be the poster child. I got great
Hmm.
boobs. I've never had any problems. I thought we'd see how it goes. Well, I came back clinically significant. What they told me is I had breast inflammation that
Hmm.
could be leading as an early detector to breast cancer.
Hmm.
So I am not somebody who likes to get annual radiation on her breasts. I've never had a problem, but I was like, what the heck?
Yeah.
So I agreed to do 3 months later. I made some changes. 3 months later, I'm still significant because we do it. It's kind of a pass fail. You either have inflammation or you don't have inflammation.
Yeah.
And that's when I got serious. So one of the things I'm going to tell you tonight is don't look at this as I don't want to know. Look at this as, okay, I've got a red flag,
Yeah.
but my genetics are not a death sentence. They're a heads up because I'm
Yeah.
happy to report here I am 9 months later
Hmm.
from my first report, and I just got a negative. Why? And that's why we're here to talk tonight. Why? I know my genetics. Two, I looked into my diet. Three, I refined my supplement, what I
Hmm.
was taking. Four, I looked into my metabolites, my what is called metabolomics. Five, I looked into my mineral status, my vitamin status, and I revamped. And
Yeah.
let me tell you, the first one to get a positive blew my mind. Okay, fine.
Hmm.
Second one to get a positive was like, have I lost my touch?
Hmm.
And the third
Hmm.
one was, hell yes, she's back. So I want to get a
And
hell
that's
yes
probably the
or a
PG
yes
version
at
of it
least.
too.
If you want to say hell yes, I'm back. Because if you have inflammation tonight, we're going to talk about 3 key genes about
Yeah.
how to get rid of it. So if you want to, yes, 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 you want to get rid of your inflammation, we're going to talk tonight about how you can take control of your health or someone's health you love by giving them resources to
Yeah.
knock down inflammation.
Yeah.
Yes, I love it.
Mm.
I love it. Thank you.
I
So,
know it's not a common story, but it's a very possible story. And I
mhm.
commend you for kind of the energy, work, and effort that you put into it, right? Because it really truly was, you didn't change your genes over the course of that time. You didn't do anything very specific in the sense of surgery or something like that for breast. You just changed how you were living.
Yep.
Yeah. Yeah.
Yep.
Yeah. And so I'm excited. I'm excited to dive into that. So in advance of these webinars, we do release some genes that we're going to be focusing on. So for those of you that do have your DNA 360, let me just quickly list those out. And then maybe as you're kind of looking to find them, we'll also go through the poll results. Because as we always say, Dr. Steph and I really just show up in order to support you. And so we want to know how we can support you best. So I'll list off the genes, and then Dr. Steph, maybe if you want to jump into the survey after that so that we can
Mhm.
understand why people are here. So
Sure.
for those of you with DNA 360, we're going to be looking at 3 critters this evening. The first one is going to be 9p21, as in 9 Peter 21. And you will find that guy in your cardiovascular section. If you go to cardiovascular, just look at the system summary, and then you'll see that there on that page of genes. Next, we'll be looking at something called COMT, C-O-M-T. It shows up a few places in your report. The quickest way to find it is going to be going into mood and behavior. here. And again, in that system summary, you'll see it listed out there. The last one that we're going to be looking at is something called GSTP1, as in Peter 1, so GSTP1, and that's going to be in your anti-inflammatory report. Again, you can go to the system summary, or you can also look at the report that says glutathionization, and you will see GSTP1 there. So staff, as you're reading out the poll results, people can
Yeah.
kind of dig through their results and get ready.
Yeah, and if you want to put in, or if we want to have our beautiful angels behind the scene, put those in the chat where everybody can see in case they want to pull them. So for the inflammatory blueprint, we ask you, how familiar are you with the concept of inflammation? And we had 44% say, very familiar. I get it. And then we had 49% say somewhat familiar. So we've got people who are here that are familiar with inflammation. They've either had inflammation, they've read about inflammation. So that's good. So we're preaching to the choir. Second thing is, have you ever taken a genetics test for health-related purposes? 35% say yes, and they understand the results. That's good. Once you understand your results, you know how epigenetically, means surrounding your genetics, you can manipulate. I look at it like a hot water heater. If you've got a hot water heater and your water's cold, maybe you've got extra people coming for the weekend. You're normally 2 or 4 of you in a house, and all of a sudden you have a house of 8. You got to crank that water heater up to have more hot water to supply for everybody for their showers. Versus when they leave, you turn it back down. Our genetics can be manipulated in those different ways by epigenetic factors, and we'll go into a little bit of that tonight. So 42% says, yes, I've taken a test, but I don't really know how to use the results. And I can tell you very early on, a lot of the or a lot of the genetics tests were like, here's all these numbers like 9p21, but what does it mean? How do I use it? What can I do with it? So we're going to go through some of that tonight. 19% said, I haven't yet taken a test, but I am interested. Tell me more. So I'm excited for you. And then some says, no, I haven't taken one and I don't really know if I need one. I don't know if it's relevant. I don't know if it applies to me. Well, hopefully by tonight, you'll see how it can apply to you and the value of having that. Our third question is, what are the primary health concerns related to inflammation? What are your primary health concerns? 60%, a whopping 60% said joint and muscle pain. So you're hurting out there. And this is very typical of the North American marketplace. So, and most marketplaces, but 60% say, help me stop hurting. 56, almost 60% again, said brain fog or fatigue. 50% said autoimmune causes. This can be rheumatoid arthritis. This can be gut, like IBS. This can be all sorts of thyroiditis, autoimmune diseases. 22% said skin issues. 68% said gut issues. Note, all your skin issues are related to your gut issues. So we can put that 68 and 22 together and we come up with, 80,
I love that you're clocking
90%.
the audience.
Yeah.
Good.
And then 47% said their heart health, good. We're going to address that. And 44% said hormonal. So we've got real good along the line, but the number one was gut health. And I will tell you from my perspective, Dr. Krista, I'd love to hear from yours. Health always starts in the heart, always starts in the gut. And that gut actually ends up going to the heart as well.
Yeah. Yeah. No, I don't disagree there. I think in particular, since we're talking through inflammation and immunity, that's where that conversation first starts, right? The gut is how the immune system understands what's going on in the world and how violently or happily it is going to react to what's happening in the world.
Exactly. Number 4, what would you like to gain most? A better understanding of inflammation? 13%. Personalized insight into my genetics. Great. So we're going to go through the 9p21. We're going to have you go through the COMT, and we're going to have you go through the GSTP1. So
Mhm.
these are where we're going to personalize. Now, are these all the
Yeah.
genes? No. These are some strategic genes that we want you to understand a little better by looking at your report. And
Mhm.
if you don't have your report, if you can't find your report, just jot down some notes. You will get a copy of this as as a replay. You will be able to go back to it when you do get your report, and you'll be able to see
Mhm.
that. 47% said natural strategies to reduce inflammation. Well, yes, we will talk about that. Again, from my personal and Dr. Krista's personal, we both are
Mhm.
inflammatory cases. uh, and
We-
then 17% said long-term tools to combat chronic inflammation.
yeah.
So, okay. And then our final question tonight was, would you be interested in getting a genetic follow-up? About 20% said, yeah, they would. They'd be interested in having someone follow up, maybe help guide them through their genetic profile, maybe show them how to get on the DNA Way app. If you don't know that we have a free app that you can upload your data into and pull off all sorts of stuff, 57% said maybe. So we'll ask you a little later to put a note in the chat, and we will have someone reach out to you so that they can help you get a little further, either on these 3 genes or something else. In fact, they just put in the chat right now about how to download the DNA Way app. So you can do that whether you're in the Google Play Store or in the iPhone App Store. And the rest said, we're good. So because you're good, let's get going. I do see some questions. Remember, we will be able to answer questions toward the end of the session. Go ahead and put your questions in the Q&A, and then Dr. Krista and I will get to those toward the end. But
Okay.
with that, we want to kind of proceed on inflammation, genes that we can look at, and how that means, what that means for you.
Yeah. Yeah. Why don't we kick it off with kind of the king of all genes when it comes to how do we curate inflammation within the body? And this is going to be 9p21. And for those asking again where you find it, this will be in the cardiovascular section. Quickly, if you just go to the summary, the system summary, you'll find it there. So what exactly is 9p21? It's technically not a gene. It's actually a location on your genome. And we're looking at 3 different parts of that location, right? When we think of a gene or a location, kind of think about it like a book, right? A book might have 100 pages, but not all 100 pages are going to be plot points. There's only going to be certain pages that are plot points. So we look at SNPs, or those pages that are plot points. And so we're looking at 3 different pages here, 3 different SNPs that really curate how inflamed your cardiovascular system is prone to be. Okay, so when we're thinking about our cardiovascular system, right, we think about this happy little heart that pumps blood, and it pumps blood through a large network of arteries and veins. Okay, and these arteries and veins are all these tubes that touch from the crown of your head down to the tips of your toes. Okay, and think about a tube, right? Inside this tube, this is where the blood is flowing, and there's going to be this one layer of cell, this first layer of cell that's always, always, always in contact with that blood. It is kind of what makes up that space that blood touches this vessel and supports it through. But because of this, right, think about anything where you see water always flowing, there's going to be wear and tear, right? So you might have something bumbling about the bloodstream that nicks it, or you might have something bumbling about the bloodstream that creates a little bit of inflammation. And so what 9p21 tells us is that when it gets that nick, or as it's getting that wear and tear, how dramatically is it going to be responding, right? So do you remember at the top of our conversation, Dr. Steph talked about there's 2 kinds of inflammation, right? There's the acute source, you get that cut, you want inflammation to help you solve it, right? To help start that healing process. But you need that inflammation to go away, because if it's always there, right? It's kind of like, think about inflammation a little bit like paramedics, right? You get a little nick, you want a paramedic to show up and bandage you up. But if it's a significant nick, or that nick goes away, you kind of want those paramedics to either go away because it's solved, or go away because you actually need to call in the doctor and you need to call in proper support, right? The more likely you have to have an exaggerated inflammation response there, the more likely you are to be creating damage within your blood vessels, right? Within this very delicate, important layer of cells. Okay. And the more that you're creating there, the more of that damage, the more likely you're going to have scar tissue, the more likely you're going to have calcification, the more likely you're going to have stiffening. And that then lends to kind of that inflamed cardiovascular outcome that no one wants. Right. So when you're looking at your genes here, we're looking at 9p21 and we put it on a scale of G's, G as in Gregory. Okay. You can appear on the scale anywhere from 0 Gs up to 6 Gs. Okay. And you can think about it very simply. If you're sitting on the 0 side, you've been kissed by the gods insofar as you're not likely to be mounting this absurd, disproportionate inflammatory response. Unfortunately, if you're sitting closer on the 6 side of things, right, that means you cardiovascularly are a lot more sensitive to inflammation and kind of create those marked responses. Okay. And Dr. Steph, just as a fun little factoid, if you don't have your genes, it's not a foolproof test, but this is kind of a fun thing that you can do to check. And people with that 6G presentation in particular really empathize with this. So Steph said we're going into bug season, right? At least within North America, we're going into bug season, so people are going to get bit. Um, I won't get into the embryology of it, but your skin shares a similar a similar sourcing as the lining of your arteries and veins. And so your skin to a certain extent is also subject to this inflammation sensitivity. And so people with higher G counts, like the 5s, the 4s, the 6s, if they get a bug bite, they're the people that tend to have that exceptionally crazy dramatic reaction that lasts a long time, right? Those paramedics come to site and they don't leave, compared to people on the lower side of the spectrum, the 0s, the 1s, the 2s. They get that bite, there's a response. Paramedics show up, but then paramedics are like, cool, you got this. And then they take off, and then it's able to calm down, and you're not itching to high heaven for 75 million days. Right? Yeah, it's stuff. Stuff. I don't know
Yeah,
where you,
totally.
yeah, I
And I
don't know where
can
you.
tell you that it changes too. So
Mhm.
when I was a child, any bite, any exposure, I was
Yeah.
just like, I would go into a room with cats, my eyes would
Mhm.
close, my nose would run, my lungs would close, and I couldn't breathe. I literally could not go into a room that a cat had been into. Now I can actually wash a cat or pet a cat, and if I wash it, my hands afterwards, I have no reaction. So because I've manipulated how my body responds to inflammation, because I've healed my gut, I have much more ability to modulate and to be exposure. I actually had a bite not that long ago. I got no itching. I did get a red spot. In fact, I noticed in the mirror, I'm like, what the heck is this? And it
Yeah.
lasted for almost a week, but I had no irritation. There was no discomfort. So
Yeah.
we can go on this pathway, but I think that's such a great way to look at it. How many of you, when you get a bug bite, first of all, you're the first one to always get a bug bite, and second of all, it lasts forever. You're just like, oh my gosh, I hate to be outside because I'm itchy and scratchy and bitey. And it put a 1 if you are very high like that, because I am in that 4 to 6 range. And so I used to
Mm.
be hyper reactive, but I've
Yeah.
toned a lot of that down. I see a lot of
Yeah.
ones. I see a lot of
Yeah.
emphasis on ones.
They're the people
Now,
that get a bug bite and it lasts until the next summer.
exactly. Now, for those of you who are ones and just put that in, go back and look and
Yeah.
see if you are a 0, 1, 2, 3, or 4, 6 on your report.
Hmm.
Big 3, okay? All right. So you could go either way. 3, 3. Are
Yeah.
you noticing? Okay, so far we've got people that are in that 5. Here we go. 4.
Hmm.
All right. Now, interesting. Becky says she's a hyperreactive, even though she's a 0.
Mm.
I would look at your gut. We can talk about gut in a
Hmm.
little while. So
Yeah.
Barbara's asking, where do I find the numbers on my report?
Yeah. So again, Barbara, you just want to go into the cardiovascular report in your portal, and you're going to see a bunch of different reports. And it's most readily accessible within the system summary. So if you go into the system summary, you scroll down a little bit, you'll see a listing of all our genes, and then you'll see 9p21 tucked in there. Yeah. All right.
Good
Any
deal.
other thought, at least? So I think the one thing I really want to emphasize before we move on to the next one, I think while we do capture 9p21, in the space of cardiovascular, we're starting to see it extend into different tissues, right? So we just talked about the skin, right? We also see it a little bit within the GI as well. And there's some research that's saying it's also involved in female sex organs, right? So ovaries and uterus. That isn't as well defined, but we're starting to see suggestions there. And it kind of stems back to this idea of, we won't get too deep into it, but embryology, how your body grew within your mother. The tissues that make up your skin, that make up your endothelial linings, are one and the same in that regard. And so they're kind of all indirectly influenced in this way. So the amazing thing to think through here is, as you start to really address inflammation within the body, not only is it going to be of help to the cardiovascular system, you'll see improvement in other systems that you weren't necessarily trying to see improvement per se in, but will be a happy little side effect, right?
Yeah. And before we leave it, when you
Yeah.
look at cardiovascular health, one of the things you have to realize is your gut health is tied to your cardiovascular health, and it's
Mm.
tied to your dental health. So let me kind
Mm.
of tell you a story. When
Please.
you are eating your foods, and when you eat food, that depending on what you eat, you spike your blood sugar. When you spike your blood sugar, insulin is released and it grabs all the sugar, and sugar gets packed away as fat. Now, if we have good fats, they can be burned off, but if they're bad fats, in our regular blood report, not our DNA report, but you go to your doctor and they do your lipid profile, you may have very high LDLs, low density
Mhm.
lipoproteins. But when you've got a lot of sugar and they're packing away those bad fats, they're replaced by polysaccharides, lipopolysaccharides, LPS, and those LPS get sticky. And then all of a sudden, that LDL becomes hard and dense. Big fluffy LDLs are fine. It's the hard and dense LDLs that start lining the arteries, lining the cardiovascular, lining your brain. And
Mhm.
that's when everything gets locked down. So if you're a 3, 4, 5, 6, and you've got big blood sugar spikes or you've got gut issues, you're
Mhm.
going to lead yourself toward cardiovascular disease. Okay,
Yeah.
so let's think about this. Whoever, yes, they talk about your diet, but whoever connects, oh my goodness, as is are my gut bugs eating up this sugar, eating up this stuff, and producing healthy things that my body can use?
Mhm.
Or are they pushing these lipopolysaccharides through, making everything crusty and hard? And because I'm genetically set up with this 9p21, all of a sudden I lay it down like brick
Yeah.
and mortar, and then my family has heart disease. Well, I can tell you my father has chronic heart disease. I can tell you no man in his family lived past the age of 50 until my father. Why did he
Mhm.
live past the age of 50? Because he was very proactive. He stayed slender. He moved all the time. And
Mhm.
because he was critical at staying ahead of his inflammation. So I love that Randy says my heart doctor focuses on my gut
Mhm.
health and my dental health. That was the second thing I said. Your mouth and all the bacteria in there are directly related to the quality of the rest of your body. In particular, if they're going to do dental health, a lot of times they'll have you take antibiotics prophylactically because all the bacteria that gets released, again, from your mouth to your anus is
Mhm.
all your gastric intestinal tract. So whether we're talking your gut or your mouth, all the bugs there, if those are bad bugs, they'll go to the heart. And if they go to the heart, they set up crusty little, you know, ledges, and those ledges break off and cause clots. So when we're looking at this 9p21,
Yeah.
if you're more sensitive, pay attention, just like Randy's heart doctor. Gut health and dental health. Those are easy places to
Yeah.
start to improve the heart.
Yeah, yeah, just to put some numbers to it. So if you're someone sitting at the 0 space, 0 to 2 in that range, you're sitting with kind of a normal risk when it comes to cardiovascular heart attack, right? A little bit more predicated by diet and lifestyle. If you move up into the 3 to 4 space, that's where you start to see an increased risk for heart attack, stroke. You're sitting probably 1.3 to 1.5 times greater risk. Unfortunately, once you get to the 5 or 6 space, you're really looking at a 1.8 to 1.9 times of an increased risk there, right? Now, I really want to be honest, when these studies were done, right, the quality of diet and lifestyle weren't always normalized for. And so we don't know what it would look like if someone has 6G and yet they live that pristine lifestyle, right? So remember, there's kind of, especially when you look at scientific studies, you always have to look at the population it's done on. And this was done on the average North American, right? So meaning a little bit of inactivity, a little bit of bad food. And I say that to the end of it's really important that you kind of shift all the factors in your favor. Because if you're someone sitting with those higher G counts, right, you're statistically more susceptible. And so we want to do all we can so that you're living the healthier and more meaningful years in a way that feels good to you. Yeah. Yeah. All right. Any other thoughts there, Dr. Steph, before we toddle on? All right, let's continue toddling. We're going to talk about COMT now. For those of you that are looking it up, you want to jump into mood and behavior, and then again, go to the system summary. You should see COMT there. Now we're actually truly looking at a gene as a book, and we're looking at a singular SNP. Okay, and so you're going to see a presentation of GG, AG, or AA. Okay, if you're sitting in the GG space, that means you're a fast COMT, and I'm going to explain what that means in a second. If you're sitting as an AA, it means you're a slow, and if you're sitting in an AG, you're kind of Goldilocks, and you're in between, and you're just a moderate rate. Okay, so what exactly is COMT helping us with? Why are we talking about it when it comes to inflammation? Okay, so COMT is part of methylation. It is the last actor in methylation. Its job is quite literally to attach a methyl group to something. Okay, now what is it attaching it to? And this is why we're talking about it with inflammation. Okay, methylation is this tagging system in the body that tells the body to do a lot of different things. One of the more important things, especially when we're talking about inflammation, is how do we go about detoxing? So one thing methylation will do is attach a methyl group to a toxin and say, poof, be gone, right? It kicks off that elimination process. It's part of that liver detox. Something else that methylation does, especially for females, but also for males, is it will tag estrogens when we're done with them and say, poof, be gone. And it kicks off that elimination process. It also, very importantly, when it comes to your genes, Dr. Steph mentioned this, we talk a lot about epigenetics, right? Epigenetics meaning we know we always carry the same genes throughout our life, but they're not always expressed the same. And methylation is one of the mechanisms, one of three, well, four, that the body has in order to tell genes, hey, you should be expressing, or no, you shouldn't be. So having access to proper methylation, both pulling it on and taking it off, is really important to how our genes are expressing in a healthy way. And the last thing it does, because I just want to quickly acknowledge why it's in mood and behavior, it has a lot of impact on neurotransmitters. We won't go into that one too much right now, but again, remember, it's this really powerful tagging system. So when you know the rate of your COMT speed, okay, right? Remember fast, Goldilocks, medium, and slow. That really helps you understand how fit, how ready you are to be dealing with a lot of different pressures and stresses within the body, especially in that cleaning up process, right? When we think through how do we clean up our body, methylation is amongst one of the most important things, especially when it comes to cardiovascular health, right? When you look at your cardiovascular health, since you spent so much time on it, you'll often hear about homocysteine. Homocysteine is a direct byproduct of methylation. And so we know how cardiovascular health is to an extent proportional to how well your body is going through its methylation. So knowing your COMT really gives insight into how strong you are at cleaning stuff up and how strong you are at that methylation. Steph, I know you're all about methylation. Do you have any thoughts or anything that you want to be adding there?
It's
She has so
interesting
many.
because, I have so many crappy genes. I'm a 4 to 6 on the
Yeah.
9p2 one. But COMT I happen to do real well. And
I
so,
know, I know.
yeah.
We're laughing because it determines a lot about personality.
And so I have this very high level of comp where I may have a lot of stuff thrown at me, but my personality is bring it on, take it, and let's get through. You didn't get wisdom by just being given wisdom. You got wisdom by having to dig in and figure it out. You
Yeah.
didn't get strength just by having here, you're gonna be strong. You have to be fall down and get back up. So my body is real big on hey, we're gonna throw all this gunk at you, but I have a strong comp so that I can work my way
Mhm.
through it. But I also, as we were talking about with mood and everything, it has the
Mhm.
shortest dopamine life. And with the shortest dopamine life, it means I may not hold my attention very long. So it's like, come on, come on, come on, get it done, get it done.
Squirrel.
Oh, yeah, yeah, exactly. So, and that's a GG. Yes, Chrissy, that's a
Yeah.
GG.
Yeah, that's the
Um,
fast. Yeah.
so it's not, again, none of the genes are, this is so bad, this is so great.
Agreed.
It really, if you look a skeleton watch, and a skeleton watch is one of those ones you can see through and you can see all the cogs as they're moving and
Hmm.
going. Not one cog is good or bad, right or wrong.
Yeah.
They all have to work together to make it
Yeah.
work. And that's really what the genes do. Some of us are born with bad genes and or less effective or less preferred, but we can compensate,
Word.
especially if you have a poor compt, um, and if you need,
Yeah.
to have help with that.
Yeah.
So yeah.
And one thing I really want to be emphatic about here, because I see this so often in the patients that come in, they'll be like, oh, I have a slow COMT, or oh, I have a bad MTHFR. MTHFR is part of that methylation pathway. And so I started taking all these methyl vitamins so that I can support it. And I promise you're going to feel worse after that. If you have a poor methylation profile, the answer is not more gas on the fire. And I
Mhm.
really, I'm pleading with you, please don't do that to yourself. Um, if you're a poor methylator, I really encourage you to speak with a clinician and to have a plan really tailored to what do you need support in, because throwing more methyl groups at someone who's not a strong methylator, be it their slow COMT or be it their methylation genes that kind of support COMT getting to its job, to that tagging job, aren't great. Throwing more B vitamins, throwing more methyl B vitamins is not going to be the solution. We have several webinars where we've talked about methylation. We've really dove deep into these genes. I'd encourage you to listen to one of those, but please, just based on this conversation of Compton, how important it is, doesn't mean we go throwing methylated B vitamins at it, hoping that it's going to work out.
Yeah. Randy, you've got a really good question. I'd like you to throw that in the Q&A and not in the chat.
Hmm.
And we'll come back to that in a few minutes.
Yeah.
And Petra, if you have a question as well, you says my methylation profile says I'm poor. If you have a specific question, throw that in the Q&A so we can get it at the end. A lot of us have poor methylation, but there are foods that you can get methyl groups from.
Mhm.
There are supplementation, and there's multiple forms of
Yeah.
supplementation that you can. And there's not just a single methyl gene. We're not going to go into all the methylation tonight, but they just put in the webinar chat, our
Mhm.
methylation webinar, and
Yeah.
we can talk about methylcobalamin and cyanocobalamin and
Hmm.
adenosylcobalamin and all the differentiators there and what might be better for you. And,
Yeah.
Dr. Chris, I'd be interested in your take, but I always tell people that whether it's probiotics for inflammation in your gut, whether it's methylation based on your genetic profile, rotating.
Mm.
Rotating is really beneficial for
Yeah.
hitting pathways. If you always do the same thing again and again and again, how are you going to change
Yeah.
your results?
Yeah.
What is that saying? Doing the same thing over and over is the
Definition
definition
of
of
insanity.
insanity because
Yeah.
nothing's going to change.
Yeah.
Rotating your probiotics, rotating your diet. This is why we have
Mhm.
seasonal diets.
Mhm.
Rotating your methyl forms depending on your methyl profile may be a better
Mhm.
choice. Being on methylated or non-methylated,
Yeah.
eliminating methylated for a while.
Yeah.
All of that can be very beneficial once you know your
Yeah.
profile.
Yeah, I think there's a lot of when you study herbal traditions, right? So supplements are a relatively new actor on the scene. We've only had technology that can extract and concentrate in the way that we now do with supplements recently. But prior to that, a lot of the prescribing methodology borrowed from herbalism, and herbalism had this really strong concept of only use herbs when they're indicated, i.e., not something necessarily you're using every day. But for those that you are using every day, there's a periodicity, there's a rotation of it. It's not something that you take the same plant every day, because what Steph is talking about is your body habituates to it, right? Think about um, an itchy sweater, right? You toss an itchy sweater on in the morning, and the first thing in the morning, you feel it, you're really feeling that itchy sweater. But as the day goes on, you feel it less and less because your body habituates to it. And with supplements, to a certain extent, for some, you're going to get that same reaction. So having an intelligent plan, and to Steph's point, keeping it spicy and interesting for your body is really important. Yeah.
Yeah, I think another way to think of it too is if you've ever done workouts and you get bored with your workout and you're not getting the
Mm-hmm.
same amount of benefit as you did before, rotating your workout. You know, that's why one day you do legs and one day you do arms and maybe you do ropes for a while, but then ropes don't make it, so you switch to kettlebells. Tricking the body up. The
Getting
body
fancy.
likes to the body likes variety, just like we like variety in our food, we like variety in our lifestyle, we like variety in our workouts, we like variety in our supplementation.
Mm-hmm.
And, you know, the universe or God in its infinite wisdom made seasons, and in different seasons there are different plants that bloom, and those, you know, if you take in during that season, which is only a few month period, then rotate to the next one and the next one, you get the variety that your body needs to stay more vital.
All right. Why don't we quickly go through GSTP1
Mhm.
Peter 1, and then maybe we shift into the Q&A, because I'm seeing
Great idea.
so many
Yep.
happy little questions that I want to make sure we
We love
preserve
that.
time for. Yeah. All right. So the last one we're going to cover is GSTP1 as in Peter 1. If you go to your anti-inflammation section of your report, again, you can go to system summary, or there'll be a report called glutathinization. I'm always so proud when I can say that word out loud, because it's a lot of syllables. So we're going to be checking into something called GSTP1. So GSTP1 is part of a family of genes that we look at, and they're called glutathione S transferase. Transferase really means they're going to be transferring something. The role of this, the enzyme that comes from this gene, is to literally take a glutathione and transfer it, attach it to an offending toxin. Okay, so when we're looking at the GST profiles, we're really asking the question not necessarily of how well do you make glutathione, because most people are quite spectacular at that. We're really asking the question of how good are you at attaching it to certain things. And the reason we called out GSTP1 Peter 1 in particular today is because I think amongst the three, while they each have their different points and spaces and importance in the world, GSTP1 is percolating to be one of the more important ones, especially in modern times. So what does GSTP1 support us with? What does it attach glutathione to? Roughly two different categories. One's kind of a natural category, and that is going to be mold spores and endotoxins and kind of anything that flies around in the air in that seasonal sense that can cause trouble within a person. And then there's the other category, which is the man-made or people-made category. And think of this as aerosolized chemicals. So this can be that off-gassing from a new car, off-gassing from kind of the funky polymers they maybe put in mattresses. This can be your air fresheners, your perfumes. This is also going to show up on your food because they use a lot of aerosolized chemicals to help with pesticides or drying or doing all this fun stuff, because we no longer grow plants, we manufacture them. So this is the guy that really speaks to how good are you at attaching glutathione to it and therefore cleaning it up, really supporting that process. Again, we're talking about liver, cleaning up and removing a source of inflammation from the body. Okay, three different presentations here. If you're an AA, the proverbial gods have blessed you. You're doing spectacular. Congratulations, gold star for you. Unfortunately, if you're a GG or an AG, not so great. You're kind of at the back of the classroom, not paying attention. When the teacher tells you what toxin do you want to attach to, you're like, I don't know, squirrel. And so these are the categories. These are the people that you got to be a little bit careful with. You don't necessarily have that grace of exposing yourself to too much, right? We talk about, you want to be healthy so that you can be happy, right? You're not necessarily like you're investing in health so that you can be happy. And a consequence of that, there's going to be times where you kind of cheat a little bit, right? You're going to have that extra glass of wine. Maybe you're going to stay up too late, and that's wonderful because that's how you want to spend your health. But those with GSTP1 suboptimal presentations, they don't have those full graces, especially for some of those chemical offenders, right? So the molds and the wheat tends to be one of the bigger offenders, or some of like the perfumes of the world. This tends to be one of the like people who are very sensitive to perfumes often have a suboptimal GSTP1, right? And so that's a little bit of a litmus test, just like we talked about the bug bites. Yeah, so this is a really important one to be looking at as to how good are you at cleaning up the junk that the world kind of piles into your body. Yeah. Yeah, you like this one, Dr. Steph, right?
I do. I like it because when you've got reactive oxygen species and oxidative stress, one of the things to look at is the NRF2
Mm,
activators. The NRF2 activators, and you can look those up, they come in a number of different forms. They can help you upregulate and downregulate. So especially if you have an AG or a GG and you don't react well
mhm,
to, glutathione, then and to taking glutathione, and maybe you have to take NAC. Look at the NRF2s, but they can help you in that one. And I think it's just really, again, it goes back to your body. It's not always what you put in. It's more importantly what you take away or clear out.
mhm,
So I think the first part of getting healthy is what are you willing to remove?
mhm,
NRF2 is exactly how you did it, Robin. That's exactly right. And actually it's NRF. There's not actually not an E, it's NRF2. The NRF2 genes literally can help you produce or eliminate. Just Google it. Just Google NRF2 activators because they are found in a number of substances and a number of supplements. But the body really wants to clean up. So whether it's cleaning up your diet, whether it's cleaning up your home, and what I mean by that is the toxins in your home, whether it
mhm,
is the drinks that you have,
mhm,
whether they've got natural flavorings or synthetic flavorings or extra sugars or chemicals. Literally removing those things from your environment and from your body is going to get you so much further ahead depending on what your genes look like. Mhm.
that. And I think that's a good transition point, I think, into questions and answers.
Yeah,
Does that make sense to you?
it does because we've got a good 20 questions in here. So let's start firing them out because
Woo!
every time we do that, I know we get more. And I know we will have to cut them off shortly. But remember, we do
Yeah,
send this out as a replay. Do
yeah.
remember that, when we asked about the the in the beginning, you can get a complimentary consult and you can get plugged into the DNA Way app if you do have more specific questions. So how about we look at David Betts? David says, can your C-reactive protein go from 1 to 4 over a couple of months? Would a meniscus tear impact something like that? What do you say?
Yes, and yes.
Yes and yes.
Yes, and yes.
So C-reactive protein is going to say, hey, we've got inflammation going on.
Mhm,
You want to have it at 0 preferably or below 1 at least, maybe a
mhm.
0.1, 0.2.
Yeah.
But if you're popping up, you've got chronic inflammation. Something is fired up. You've got an infection, you've got a trauma, you've got something brewing. So
Mhm,
absolutely. And a meniscus tear, if you don't go in and take care of it, it's kind of like having a hangnail that rubs and rubs and rubs. And it's like
mhm.
you never feel that finger until you have a hangnail, and then that's the only place you can
And that's
feel.
the only thing you're aware of.
Yeah, exactly. So yes,
Yeah.
David, it can, and yes, it can.
Yeah. That's a good answer.
Okay.
All
David
right.
also says, if you have psoriasis, is that genetically induced? I'll let you start.
Woo! Yes, ma'am. All right.
Both
So
of us could address that one.
we're going to jump in. So, are there genes that are highly correlated with presentations of psoriasis? Yes, there are. I want to be very specific, though. There is not one gene that says you will or will not have it. It's more likely going to be a constellation. And I also want to be very specific here. There are people with constellations that say genetically you probably should have psoriasis, but they do not. And the reason for this is psoriasis is an autoimmune condition. And by and large, most autoimmune conditions need some form of trigger, right? So that trigger can be, for example, a viral incident, right? You have a virus and that kicks it off. For some people, it can be a chronically inflamed diet, right? A diet that really does not jive well with their body. Either, maybe they're sensitive or allergic, and it creates this disruption within the immune system within the gut. Dr. Steph, we always go back to the gut, especially for autoimmune, right?
Absolutely.
Sometimes I've seen like chemo or other really aggressive life events percolate up an autoimmune condition. Think about it kind of a big life stress that can do that. Okay, so the one thing I really want you to focus on here, if you're interested, I think in working up, do you have genes very specific to psoriasis? You might want to speak with a clinical geneticist, but the power you'll see within some of our testing is, how do you go about managing that? Right? What are things very pointed to you that you can do to reduce inflammation and cater to what your body really needs so that those cataclysmic events, right, don't take hold and percolate that autoimmune condition up, right?
Yeah.
Any other
So,
thoughts or what you want to add there?
yeah. So, David, as far as psoriasis goes, I tell all my clients, I want you to imagine that your body is a donut. How many people don't love donuts, The
Oh gosh, I
outside of
miss
your
donuts.
donut, I know. Oh, the days I
We're
used to
both
have
we're both
donuts.
celiac, so neither of us get
Yeah, we don't
donuts,
do
and I
donuts.
drool when I hear about these things. I
So
miss
the outs,
donuts.
I have still promised you a croissant when you come down. I told you I would make the gluten-free croissants, but anyway, if the outside of the donut is your skin where the psoriasis is, the inside of the donut is your alimentary canal. That means your mouth, your esophagus, your stomach, your intestines, all the way out through your anus. Okay. Whatever you're seeing on the outside is also happening on the inside. The donut hole is made of the same stuff that the outside of the donut is made from. So if you're having that dryness, that scaliness, that irritation, your gut is having the same thing. Go back to the gut to clean up the skin. When you see
Mhm.
people that have beautiful skin, look at how beautiful Dr. Krista's skin is. You know that she has a clean gut. Okay. So psoriasis is definitely genetically induced, definitely gut related, definitely manageable. So we go
Mhm.
there.
Love it.
Christina says, Dr. Stephanie, how did you do your inflammation test for your breast 360, your DNA
Mhm.
breast 360?
Yeah.
I did multiple inflammation tests. One, I did a Dutch test for my hormones. And then when I talked about the metabolomics are your metabolites. In the Dutch test, you can either do organic acids test. The Dutch test actually has organic acids in it. You can look, what is your metabolites? It means I put a food in, I put a substance in, such as my hormones. My body processes it through all of my different genetic pathways, and then it has metabolites. How does it get broken down? So it's not just cake and flour and eggs, and then, oh my goodness, you have something fabulous. It's, did I end up with a rock or did I end up with an angel food cake? It's how you put it together and how it comes out. I looked at my Dutch test and I saw massive inflammation and I saw glutathione pathways and methylation pathways that were not being optimized. So I optimized those. I also did hair tissue mineral analysis and looked at my vitamin status, my heavy metal status, and my different mineral status, and found I was massively depleted in minerals that I needed to replete, meaning add back to my body. So I removed the toxins that were building up and I added back the minerals that my body needed to do it. And Christina, if you're interested specifically in the breast DNA 360 or because you have massive inflammation, go ahead and call concierge. We can do an episodic visit. I'd be happy to visit with you, look at your profile, and see if there's something we can do to help you. Okay.
I love that.
All right. How about Robin? Do you want to take Robin Blake's?
Yeah, so Robin is saying that they have 5Gs, so this is their 9p21, so that
Okay.
higher end of the spectrum that we know is susceptible to cardiovascular inflammation. However, she sees that 1p21 says AG, and so that reduces the risk of cardiovascular disease and LDL cholesterol. So yes, we didn't really dive too deeply into 1p21, so we do look at another SNP that when someone comes up with a relatively rare, I believe it's the G allele. Please don't quote me. It could be the A. I always mix up the letters for this one. Your report will tell you. But if you have one of the rare, I think it's G alleles, this as a standalone is known to reduce, or we see it in high correlation of better cardiovascular outcomes. Okay. And in particular, because it really supports better management of some of those sticky, icky cholesterols and LDLs and lipid particles that Dr. Steph was talking about. Okay. And so at present, there's not really an algorithm that says if this many for 9p21 and that many for 1p21, it means this. It's going to be something that you'd really be working with a clinician to understand the totality, especially amongst other cardiovascular genes, right? We have a full cardiovascular report that looks at hypertension, cholesterol, amongst other things, and stress, right? All of which would influence that risk. And so I would say don't take these two alone. You really want to look at the totality of all of them. But having that heterozygous presentation, and I think it's the G allele, tends to have more beneficial outcomes. I wouldn't be able to say though, does it fully balance out? It's just that yes, you have that struggle, but you also have a little bit of a helper there. And
So
so that would be
heterozygous, just for anybody who doesn't know that word, means
thank
one
you.
of each.
Yeah.
Hetero meaning like boy and girl.
Yeah.
And so it means you have one of each of the genes rather than you have two of the same.
Thank you. I
Welcome.
appreciate it. Nerd
Sometimes we
translator.
just take that for granted because we do it so often. So you
No, I
are in
like that you're a
beautiful
nerd
professor
translator.
mode. You
You're
are
a nerd
beautiful.
whisperer, and I love it.
Okay, Patricia says, I've done Viome and the results allowed me to customize food and supplements. Do I still need to go check my blood through the DNA company? What is a high ferritin?
Or what causes?
Yeah, what causes high ferritin? So when you say check your blood through the DNA company primarily, while we do blood tests, our primary are our genetic tests. So what we're testing here is your DNA profile, say, of all of your DNA, which is our DNA 360. We also have a longevity profile. We also have a gut profile. We also have, our DNA 360 breast profile. And so if you're saying, do I need to do my blood test through the DNA? Oftentimes people do it with their regular practitioner, but they'll bring it to a DNA consult if you've done your DNA 360 and you're getting a consult on your DNA 360. I don't know if that's what you meant. And high ferritin has to do with iron stores. Your body is not eliminating the iron stores. It could be your diet. It could be that you've got an active infection. There's a lot of things that can raise ferritin. Krista, what would you say to that?
Yeah, I see, Patricia, it depends on how old you are, because I see sometimes women's ferritin iron stores going up postmenopausally because they have a condition called hemochromatosis and their periods balanced for it for the most of their life. So I'd also want to know how old and kind of when you started to see these things go up. But I think especially since we're talking inflammation, that's a really good first step pathway, right? Body shifts what it's presenting and what it's doing when it's inflamed. And there's lots of little hints along the way, and ferritin being one of them.
Yeah, I think
Yeah.
that's great. The first thing I would say is Allie or Gabby, can you reach out to Christina? She's looking for some information about getting a Dutch test and possibly a consult. And then let's see here. So Isaac says, would a Dutch hormone test also help with inflammation? I've lost over 100 pounds, was diagnosed with
Look at
rheumatoid
you.
arthritis, Raynaud's, ringing in the ears, cracking joints, high blood pressure. I work out 6 days a week. I do fasts anywhere from 16 hours to 5 days. I
Yeah.
recently did a tox test and I have 14 molds in the red and most being up to
Hmm.
3 times over the limit with 20 in the yellow. I'm able to put my RA in remission without medication, but could the molds be causing most of my issues? 1,000%. I probably would not recommend, Isaac, a Dutch for you. The Dutch for the guys, while it works a lot with testosterone, it works a lot with your cortisol, but your cortisol is going to be all over the place with your mold. I would
Hmm.
far more like to see you get your mold in remission either with a DNA gut test, or since you've already got that, I'd like to have you work with a practitioner on your gut health,
Yeah.
remediating your gut health, and you could go from there for sure. But I would not say a Dutch test would be my next thing. And there are several peptides. If you're not aware of peptides yet, look at Level Up, LEVL peptides. Their founder was a young man with massive mold issues, and he's got whole mold protocols that I think are really good. So that is probably where I would send you. And then bring that back and let us work with your DNA to really find out which of your pathways are preventing you from healing. Yeah.
Mhm. Amazing.
Becky says, can you repeat which are the fast and slow copies of COMT?
Yeah, so for fast, you're going to be a GG, which is Gregory Gregory.
Mhm,
And then if you're on the slower side of things, it's going to be an AA or an Andrew Andrew. Yeah.
mhm. Great. Robin also has a comp question. I have comp AG, but my homocysteine is too high. I've had
Mhm.
serious B12 deficiency that was not diagnosed in a timely fashion, so I have permanent nerve damage. We hear that
Oh,
so often.
oof.
What besides B12 is
Sorry, Madel.
responsible for higher homocysteine?
Yeah, so I would really encourage you, Robin, to be looking into the methylation report. So that's going to be
Yep.
the anti-inflammatory section. And we want to really be honing in on B9 or folate. Okay. So folate is a vitamin, a B vitamin that should be coming from our dark leafy greens. Foliage. There's some genetic presentations, though, that need a little bit of support, namely those with a suboptimal MTHFR. Oftentimes, they need a form that's a little bit of a, you're not necessarily going to find it in the dark leafy greens. It's going to be a methylated form of that. You can take it supplementally. But I'd really encourage, in parallel to that, checking out your SHMT1. This is very unique to us and also very, very important. If you have a suboptimal SHMT1, and your report will indicate that, methyl B9 or methylfolate is not a great life decision for you. Um, Without getting into it too deep, it's kind of like saying you have a really weak player on the court, and instead of trying to help them out and give them extra support, you just kind of throw them into the middle of a really intensive game and are like, you'll figure it
Keep,
out.
keep, keep throwing the ball. Eventually, they'll figure out something to do with it. Not,
Yeah, and like a broken
not.
clock can be right twice a day, but that's about it. So
Mhm.
make sure you're going through that report, because I think there's a lot of emphasis when it comes to methylation of just take all the methyl B vitamins and you'll be fine. And we've learned through our genetic testing, in particular, the specificity of some of the enzymes that we look at, that that is not the case. So please jump into your report. Please understand how your body is set up. And if there's any struggle points, any questions, don't hesitate to reach out to us. We can have someone support you walking through that section of the report. And if needed, we can even get you aligned with a clinician who can figure out the clinical plan to support reducing that homocysteine. Okay.
And yeah, again, our beautiful support team. Um, Robin says that his methylation report was good. That's why he's confused. So that may be
Mm,
something to touch bases with him. Now, I
yeah.
will also say you really need to add TMJ or TMG,
TMG. Yeah.
trimethylglycine. That will really help bring that homocysteine down. And watching your homocysteine is far more important to prevent that cardiovascular
Yeah.
disease. When you've got that homocysteine down, you bring down the inflammation. When you bring down the
Mhm.
inflammation, you have less likelihood to lay down all that atherosclerosis and have long-term cardiac problems.
Yeah.
So, yep,
Yeah.
good.
Yeah.
All
And
right.
just, Robin, given your kind of moderate comp, just don't go too high on the TMG. It's
Yep,
important. Just
yep.
don't go crazy high doses.
Less is more.
Yep.
All things in moderation. There you
Mhm.
go.
Yeah.
Lori Land, what does AG comp and GSTP1 mean also for poor methylation? I think we kind of just went through that.
Yeah.
Yeah, I think we can go back. Lori, I think you can
Yeah.
pull that out of what we just did. So Randy, I asked you to put in, so my GG comp help out balance my 6 for my 9P21. Um,
Yeah.
and yeah, it does. Yeah. And so because you can clear, because you can keep things moving, because so even if you've got the junk there, you just escort them to the door. It's like you've got a lot of good bodyguards. Just keep
Yeah.
saying, just keep moving. Kind of if you've ever been in a big crowd or if you've been at a big event, keep moving, keep moving, keep moving.
Yeah, I want to emphasize I don't think it balances out insofar as it completely negates the six. It just
No.
means you've really strong helpers and you have points with which you can really help reduce that inflammation. It doesn't make that baseline risk go away. It just means you have great people to support you, especially if and when it crops up.
Yep. Perfect.
Yeah.
Um,
Yeah.
So Petra says, could my extreme inflammation come from my poor methylation? Oh, I like how that rhymes to me. Could my extreme methylation come from my, or inflammation come from my poor methylation?
The
Absolutely.
artist in you coming out.
Yeah, there you go. Absolutely. It's a very clear contributing factor.
Hmm.
Mhm,
Yeah. Yeah, absolutely. And I think it may not necessarily be the root cause, but by
mhm.
supporting it, you will absolutely support figuring out root cause and the healing thereafter.
Yeah. And so I would say, Petra, look at your gut health. Look at your elimination pathways, look at
Mhm.
your methylation, kind of they all go together. Look at how much you sleep, the
Yeah.
quality of your sleep so that you can actually heal. One thing that people
Mhm.
forget is they have no energy and they just want to go go go. Part of the reason you have no energy is your body is saying you need to rest. The only time we
Mhm.
heal is when we rest. So doing more is not helping you heal, it's not reducing inflammation. Okay?
That's sometimes a very difficult message to receive. And I say that
It
personally.
is.
Sometimes when I know I need to rest, I'm like, do I?
Yeah.
Tempting not to. Yeah.
And Danielle says my comp result is a G. So we just went through
Yeah.
that. GGs are
Yeah.
good. Um, please help. I have 0 to 2G. How can I find which I am? Christina, again, we went through that. If you go back, if you want to rewatch this, we'll go back through that and
Mhm.
we've listed where you can find that in your report.
Mhm.
I have poor methylation, low homocysteine. Can you help explain, please, and what I can do?
I wonder how low. So
I was
typically
gonna
you
say, I
want,
don't know that I see that as a problem.
unless they're kind of dipping below 5, how low do you like people to go with homocysteine?
Yeah, I would say I rarely see people at 5. I see people at 8 and 16 and, far more. So,
I've only seen it was a case report, but I've seen a few people dip below just based on extreme supplementing, but
yeah.
um
I was
yeah.
gonna say the 90-10 rule is like, yeah, I don't see low. She says her homocysteine is a 3, though.
Her homocysteine 3. Oh, so that is sitting on the lower side.
That is anyhow.
That is sitting on the lower side.
All right, let me Google something real quickly. I want to check into something.
Yeah, yeah, I'd have to jump back to the I know it was extreme supplementing and I think it was a very specific makeup of B vitamins. But I think for support, I'll let Dr. Google some things.
Yeah.
But we'll probably also just want to see you specifically in clinic for that because there's going to be a lot more questions around that 3 that I think we could probably get through in a webinar.
Yeah, and the two biggest things that it says, as you just said, dietary factors primarily. The
Mhm.
biggest suggestion is your protein's too low.
Mm.
So when we're looking, more and more protein is being advocated as really vital, but digesting that protein is really critical. It's not just take
Yeah.
it in and hope that it goes through. You've got to so a lot of times take digestive enzymes with it to break it down so the
Mhm.
body can utilize it. So I would look at your protein intake. And Krista, what levels of protein intake do you like to take? Because I can tell you what I like, but
Oh gosh, it depends on the person and health goals.
Mhm.
I tend to sit, I mean, on the very low end, about a gram per kilogram, or on the higher end, a gram per pound, depending on the person's health goals. I think a gram per kilogram often is a little bit too low, sitting a bit higher, but I want to respect there's different dietary abilities out there. Where do you sit? How extreme are you?
Well, like I'm 140 pounds, so
Mhm.
140 grams of protein is going to be pretty hard. But I try to hit for 90 to 110.
Mhm. Yeah.
And so definitely I like to do at least 30 grams of protein, 30 to 40 grams of protein. And I'm 62. So
Mhm.
30 to 40 grams of protein at 140 pounds really is what I need to, if I'm going to keep my muscle mass on, because I am massively working on not having sarcopenia, which means losing your muscle
Love
mass,
it.
keeping
Love
your
it.
body fat down, keeping your muscle fat high. That also, muscle mass, not fat, high. That also helps with burning, excess fat off, keeps you away from having fatty liver. It's just healthy longevity. I used to want to live to 100 and beyond. I don't care about that anymore. It's about health span, not
Yeah.
lifespan. So
A
I'd
dead
rather
span.
have I'd rather, just like my grandmother, she lived till she was 93, but she lived in her own house by herself,
Mm.
drove, went to bridge, played dominoes, all these kind of things, cooked, cleaned, everything. And then she actually fell down her stairs, broke a knee, and they said, "We're going to put you in rehab." She thought that meant nursing home. And she said, "I'll never go." She shut her eyes and she was done that night.
Mm.
She was so determined that there was nobody
Mm.
was taking her. She was never going to be in one of those
Mm.
old people places. I mean, that's the way to
Mm.
go. She literally drove until 2 weeks before she passed. So it's all about, for me, about health span and not
Yeah.
lifespan.
Yeah. And
But
her
Evelyn, I
swim.
would say the number one thing is protein intake and
Yes.
look at your absorption of your other vitamins.
Mm-hmm. Mm-hmm. All right.
Mhm.
So Tina has offered us, um, okay, so Tina's offered a few of her methylation genes, and then she's also offered some of her glutathione genes. And so both so Tina, I'd need to see the full listing of your methylation genes. Remember that we have, at least our report looks at 7 different genes, and all of them are really important. Think about methylation, and again, watch the webinar, but think about methylation kind of like a team sport. If you're only focused on one player, if you're only focused on one gene, you actually don't know what's happening in the game with the team. You have to see the full team. So you may actually have okay enough methylation based on your other players. I don't know. But you do have a slower COMT, and then you are saying you have several deletions when it comes to your glutathione family, meaning that ability to attach, right? And so we'd want to know what your health goals are. I think in general, though, you really, really, really want to be focusing, number one, on eliminating any environmental toxins, right? So Steph talked a little bit about mold. We've talked about bad food. We talked about stress. That's an environmental toxin, right? Those sorts of things that are kind of things that you can control and that you're asking your detox system to deal with. Because if you don't have a great detox system, you don't want to be asking your detox system to deal with extra, right? And then separate to that, we probably want to know what's going on in your health so we can very targetedly suggest other supports, right? Because reducing inflammation, one of those systems, reducing the reliance on methylation and glutathione in one of those systems might have a bit of a different approach. In general, though, you could also think from a supplementation perspective, something like Detox Optimizer, where you're getting a lot of the precursors
Yeah.
to glutathione, which can be helpful, especially for some of our deletions, as well as Methylation Optimizer, which supports with all those Bs and TMG, the trimethylglycinate, for those that are looking to support their methylation, but in a very gentle way. We purposefully have a very gentle formula.
And
So
so that people understand when she's talking about detox optimizer or
yeah,
methylation optimizer, if you go onto the DNA website,
nerd translator.
yeah, there there is an area called supplementation, and we have some custom-made supplements that are black label supplements because they use such high quality and because they are used for people who have those deficient SNPs that like I can't find anything
Yeah,
that works for me or I can't find, and so those are really, really good places to start
yeah,
if you're looking for something there. So go on the website.
yeah.
Speaking of going on the website, if you haven't registered for the She Summit. We have a She Summit next week. And it's going to be all about kind of fertility, infertility, whether it's for you, whether it's for a child, a grandchild. If you know somebody, we really want to, the birth rates worldwide are going down, and especially in the US. And there's a lot of reasons that we believe for that. And part of it is the toxic exposure, the stressed exposure, things that people don't even realize. And if you're massively inflamed, you're not going to get pregnant. So you may not be looking to get pregnant. In fact, many of you, like me, would be saying, oh, God, no. But I have children and grandchildren, and I want to make sure they're preserved. So this is a free summit for you. We'd love you to register and hop on that and learn a little bit. And you can pick and choose, or you can stay with us. It's a couple hours every day over 3 days. Lots of experts, lots of great information, and pass it along to somebody else if it's not right for you. So we would love to share that with you. Our final question tonight is from Melissa. It says, is there more general question about epigenetics? People always talk about lifestyle choices, turning your genes on or off, kind of like I said, like the thermostat on your water heater, if you have more people or less. If you had made some poor lifestyle choices in the past, and most of us have, join the club.
It's important.
It
Mistakes are
affected
important.
and it affected your genetics negatively, is it possible to make better choices in the future to turn them back on? What a fabulous final question.
Oh, yeah.
Yes, it is.
Yeah.
And Dr. Krista, why don't you go through a little bit quick of your story about not wanting to own your celiacs and your inflammation?
It took a long time. It took a long time. Before I do that, though, I do want to offer a little bit of a real-time example that I think most people can, to a certain extent, identify with, right? So when we think about genes, we have all the genes, right? We have all the genes, and it's a question of, do we turn them on or off? And the easy example of this is, think of the liver. When you drink a glass of alcohol, right? When you bring in the element of ethanol, your liver has to clean that up, okay? And if you're someone that is consistently drinking alcohol, your liver is aware, hey, I often get this ethanol toxin that I have to deal with. And so from an epigenetic perspective, there's going to be a bit of an upregulation as to the enzyme that the liver creates so that it has ready stores, so that when you get done your day and you take that glass of wine, the liver's like, cool, I'm ready. I've already made all these enzymes. If you, for whatever reason, abstain from alcohol for a while, your liver's like, oh, I'm no longer using this enzyme, and it's going to modify its production. It's actually going to stop making it. Does that mean you no longer have the gene? Nope, you still have the gene. It just means you're not expressing it. And so let's pretend you abstain for a year, and then after a year, you have a glass. What's happening is the liver's like all of a sudden shocked. You don't have that enzyme. And if you continue to have glasses after that point, your liver will start to turn that on again and start to make it again. And that's a really easy example, a tangible one that a lot of people can identify with, right? Of that turning on and off. Right. And so that's something to be very, very mindful of. And the story of my reluctance, my stubborn came out long and hard around this one. So I am celiac. It's in my genes. It's in the way my body experiences the world. And I probably knew that in my late 20s, but I don't think I acknowledged it until my mid 30s is when I was kind of actually serious about it. Because croissant is my deity. I am culturally French. Like, it's just out of my cold dead hand, can you take my croissant? That's my feeling about life. And I stuck with it for a really long time. But it created incredible amounts of inflammation within my body because it inspired these autoimmune attacks. And additional to that, right, the wheat within North America, there's a lot of pesticide burden, et cetera. And I have, like some of you out there, really crappy GSTP1. So not only was I being offended by the gluten, separately, I was offended by all the toxins that the gluten carried with it. And so my body, especially from an epigenetic perspective, had a lot of patterning of inflammation, right? So when we look at genes, we don't have the technology yet to really say, is this one turned on or off? But we do have technology that's able to say, from a pattern perspective, do you have lifestyle patterns that influence inflammation? Because we can recognize those patterns, and your body then almost becomes more set up for that inflammation pattern. And we can also see those patterns receding. So we do have technology now to say, we see signatures on your DNA of inflammation and stress. And over time, we can actually see those signatures change. So this is really neat in that, will diet and lifestyle, did my inflammation signatures change once I finally bowed to the fact that I no longer got wheat? Yes, my whole body changed. I was unfortunately markedly for the better. Still very bitter about it, but it's one of those things that it reinforced itself. I'm never not going to be bitter about this. It reinforced itself over time. That change, I began to see a world outside of inflammation that I felt so spectacular that unfortunately it became a self-fulfilling prophecy, and that I now avoid it. I think the last time I had it purposefully was 2 years ago when I was in Italy, and I was like, maybe if it's Italian wheat, I'll be fine. And I wasn't. It was horrible. I will never do that again. But it's really neat that even though we have genes for things, how we express, how we experience those genes, and how what we choose to do, how that can engage and change the way we are expressing. It's very, very powerful. And I think, like Dr. Steph, your story of that breast inflammation and
Mhm.
all you went through in order to shift that, it's really important to know that while inflammation is a big scary word and everyone's scared of it and thinks it's never going to go away, it absolutely can. It did for Steph, it did for me,
Mhm.
assuming I stick to my guns and don't consume, but we'll get there one day.
So I think one of the things for you to know and own is how beautiful. Nothing's going to be 100%. Chris is good, 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 and then she backslides. Good, 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 and then she backslides. I mean, 2 steps forward, 1 step back. Life is a cha-cha. But nothing tastes as good as feeling good feels. And
Yeah.
it starts with a decision. When I had cancer at 21 and I was told you may never have your babies because we may have to rip all this stuff out. And I was like, oh, I'm having babies, So it was worth 2 years of severe dietary restriction and 143 pills a day. Now, do we have to
Mhm.
do that? No, because that was back in the dark ages and we didn't know any better. Now we know how to target this stuff, which is why the DNA thrills me so much. Because had I known my DNA then, had I understood the pathways that we can turn on and turn off, that would be done. But that's why when I got a test back that showed positive for breast inflammation, and the potential with this test is that you can show from stage 0 breast cancer, so those pre-inflammatory, and it was like, okay, you've got beginning inflammation, you've got specific proteins that are showing that are indicative of future breast cancer. Do you want breast cancer now or in the future? And the answer was no, absolutely not. What was I willing to change? Diet, lifestyle, sleep, hormones, mineral status, metabolite status. So taking that whole picture, it's a bit like a Venn diagram. And we'll close with this. Here's your DNA, and then you overlap it with here's your blood stuff, and then you overlap it with here's your mineral status, and then you overlap it with your organic acids, and right in the center, that's where you are. And that's where I knew I had to get. And it didn't take me 3 months. It didn't take me 6 months. It took me 9 months. But in 9 months,
Mm.
same as growing a baby, I was able to reduce that inflammation and get an all clear test. So know that you are empowered. And if you don't know how, we're here to help. And because of
Mhm.
that, we're offering the She Summit to learn about,
Mhm.
fertility. And are we going to talk about just fertility? No, it's going to be inflammation, and it's going to be changing your hormones, and it's going to be so. You're welcome to join us, even if you're like, God, no, I don't want to get pregnant. But know that we do these webinars to serve you. We do our podcast to serve you. We have our app to serve you. We have our DNA magazine. We have so many free resources, and you put that all together. And then if you want to consult, we're here to do that. And in fact, right now we have a 10% off any test. So if the DNA Breast 360 screams at you tonight, go get one. If you haven't had your DNA done, I recommend that you start with your DNA 360. If you've had that done, but you're like, is it working? Is it not working? Look at the longevity, especially the longevity plus and premium, so
Mhm.
that you can see, is what I'm doing working? And we just really appreciate you showing up, being here. We ask you to share this with your friends so that they know how to improve themselves. What's important is when you're looking good, feeling good, eating with people you love, sharing information you love. That's how we build community. And we're in a place of rebuilding right now. community around the world and cohesiveness, and your health is your wealth. And we want you to be part of a healthy community. Robin, there's all sorts of different consults. What we'll do is we'll have somebody reach out to you and they can give you the whole thing. All right. Take care. God bless everybody. We love you. Anna, thank you. God bless you. Thank you, Allie. Thank you, Robin. All of you so much. It is our pleasure to be here, and we just love it that you stayed till the end. Take care, guys. God bless.
Au revoir, mes
Bye-bye.
amis.
Au
Au
revoir.
revoir.
Je t'aime.
Je t'aime aussi, mon Dieu, Madele. Look at you being so foxy.